thank you once again for joining us. Just to let you know that this is being recorded and live streamed on YouTube. We also have live simultaneous translation into French. So French-speaking colleagues, please listen to the French channel. You can access it at the bottom, via the usual Zoom link button. And for those who are English-speaking, please listen to the English channel. Thank you once again for joining us today. I am 𝗠tože😂 the lead for gender equality and intersectionality at the United Nations University, International Institute for Global Health based in Kuala Lumpur, Malaysia. It is my pleasure to welcome you on behalf of the 𝗠ន់себ Consortium to this webinar titled Rethinking How We Address Gendered Workplace Violence in Primary Healthcare Settings, an open dialogue with Dr. Abi Badru. This webinar is being held within the 16 days of activism against gender-based violence, with today also marking Human Rights Day. And I am sure we are all very well aware of the staggering figures of 1 in 3 women estimated as experiencing violence within their lifetime. And if we convert that to numbers, 4 billion women around the world, and if we think about 1 in 3, that means roughly 1.3 billion women are expected or are experiencing violence in some form. And this is a crisis of immense proportions. And violence takes place not only in homes and private spaces, but also at work. And estimates indicate that more than 60% of health workers experience some form of workplace violence. And not only does this undermine the safety, the well-being, and the agency of healthcare workers, especially at primary healthcare level, but women in particular, who comprise the majority of the primary healthcare workforce, are particularly exposed to gendered workplace violence, which is fueled by gendered occupational hierarchies, which are widespread, restrictive societal norms, and deeply entrenched power inequalities that are very much replicated and reinforced within health systems. And yet, despite the data, despite estimates on prevalence and documentation of the substantial impacts, workplace violence and its gendered dimensions remain underdocumented, underproblematized, and excluded often from programmatic action and institutional agendas at global, national, and local levels. The 𝗠tože😂 Consortium, which means to strengthen in Swahili, is a multi-country 5-year endeavor funded by NIHR, aimed at understanding and addressing workplace violence and its gendered dimensions, particularly those experienced by primary healthcare workers in 3 different countries: Burkina Faso, South Africa, and Tanzania. The consortia is driven by the School of Public Health at the University of Western Cape, the Institut National de Santé Publique, and RESAD, both of which are in Burkina Faso, and Ifakara Health Institute, along with UNU-IIGH. And the consortium is hosting this webinar today to draw attention to gendered workplace violence in the primary healthcare workforce, but spotlighting one of the consortium's advisory group members, Dr. Moradake Abiodun Badru. And she will be sharing her views on the topic and sharing more about the critical work she has been doing for a long time to tackle gendered workplace violence and advocate for health worker rights. But before I introduce Abi in full, I would also like to introduce my co-moderator, Zongo Arlette Raissa, who I have the pleasure of co-moderating this webinar with. Arlette holds a master's degree in sociology with a specialization in health, and is currently a doctoral student in sociology and a research assistant at RESAD, one of the consortia members with the 𝗠tože😂 Consortium. And before I hand over to Arlette, I think I would like to spend a few minutes just to give you a bit more detail. I mean, Dr. Abi's full bio will be shared in the chat, but I wanted to share with you a bit about her profile. She's a distinguished health professional and a leading expert in gender and industrial relations from Nigeria. She has a PhD in social justice and a master's degree from the Global Labor University. And she brings over 2 decades of experience in public services, health, and human rights. As the current project coordinator for English-speaking Africa for Public Services International, PSI, she's a fierce advocate for the human rights of internally displaced persons and a champion for community health workers. Previously, she served as the Equality Officer for the National Association of Nigerian Nurses and Midwives. And so now I have the pleasure to hand over to Arlette so we can begin this dialogue. Thank you so much.
Ok, bonjour tout le monde. J'espère que tout le monde s'est bien réveillé, que ça va. Je suis Zongo Arlette Raïssa, je suis sociologue de formation, assistante de recherche à RESAT, Recherche pour la santé et le développement. Pour ce webinaire, je suis chargée de co-modérer avec Johanna. Voilà, parce que je suis ici aussi du consortium. Dans le consortium, on a l'INSP et puis à RESAT, avec d'autres pays tels que la Tanzanie et puis l'Afrique du Sud. Et pour aujourd'hui, nous allons échanger beaucoup plus sur les violences faites en milieu hospitalier, les violences subies par surtout en ce qui concerne les formations sanitaires primaires, les CFS qu'on aime communément appeler, c'est-à-dire les formations sanitaires qui sont beaucoup plus proches des populations. Voilà, c'est ce que je peux dire en gros. Donc, d'ici là, on va commencer voilà, la présentation avec Dr. Abi, qui est une spécialiste en la matière. Voilà. Merci.
So Abi, maybe you can begin by telling us a little bit more about Public Services International, the work that Public Services International does with affiliates in Africa to tackle issues around gendered workplace violence.
Joanna, it's a pleasure to be here and to have the opportunity to share what PSI does in Africa and what we've been able to accomplish so far. Primary healthcare workers in Africa. Public Service International is a global federation of more than 700 trade unions representing 30 million workers in public services across 160 countries around the world. Its mission is to defend quality public services, promote workers' rights, and strengthen democracy. Promote also equality and social justice. PSI advocates at national and international level, including at the ILO, WHO, and UN, to ensure that public sector workers have safe working conditions, fair labor laws, and strong collective bargaining systems, and freedom of association. The organization also leads global campaigns on gender equality, decent work, climate justice, and protection of frontline workers. In Africa, PSI works closely with its affiliates, especially union representing nurses and midwives, community health workers, hospital staffs, and utility workers, and so on, especially just within the public service. And we work to address issues of workplace violence, which disproportionately affect women in the health and care sectors. PSI supported multi-country projects in East, West, and Southern Africa that train unions to prevent, document, and respond to violence and harassment at work. This initiative often built on ILO Convention 190, the first international standard to address violence and harassment in the world of work. PSI provides affiliates with practical tools for bargaining, bargaining protection into workplace, bargaining for protection, and also asking or demanding for Convention 190 to be, included in workplace policies, creating confidential reporting system, and strengthening women leadership in the union. So PSI continue to expand partnership with civil societies, women organizations, and global bodies to promote gender transformative evidence-based advocacy and international standard setting. PSI helps ensure that primary care workers and other frontline workers in Africa work with dignity, safety, and respect. Let me stop here. That's a very brief explanation, or
Abi, can I just take a step back and maybe you can tell us why do health worker unions?
Introduction to what PSI does. And I must say that PSI is in over 10. I don't understand. Why do health workers union does what?
Sorry, I think there's a bit of a lag, so I unmuted when you hadn't finished. Sorry, Abi, can you hear me?
Okay. I can hear you, yes.
Sorry, there's a bit of a lag. I thought you had finished.
There's a lag.
Yeah, I thought you had finished. I was going to ask if you can just explain why health worker unions, what is the importance of unions, particular and unionizing as a workforce, to address some of these issues? What is the strength or the advantage of unionizing and PSI, working through unions? I think we have some connection issues. Please bear with us a minute. I think Abi is just rejoining. Hi, Abi, welcome back. Sorry, you're on mute. The connection. Yes.
Hello. I hope you can hear me now.
We can hear you now.
Okay, thank you. I'm sorry for the break. Yeah,
No
it's my
problem.
network here.
No problem. I
Yes,
was just
you were
asking
asking
Abi.
a question.
Yes, sorry, I thought you had finished responding, and I was just asking if you can explain, what is the value of unionizing, of health workers forming unions to advocate for rights, for safety? So the value of unionizing, because PSI very much works with unions. So it would be good to hear a little bit on that.
Yeah, I would do a little bit of my background. I started my career as a nurse, midwife, working in a rural setting in Nigeria, a very rural environment where there was no pipe-borne water, electricity, and it's very difficult, to carry out procedure. Especially, I worked in the maternity room where we have deliveries and we will need a lot of water. At times, we also require mini surgery, electricity, we had to refer for what we could do. So it was really difficult, speaking alone for this thing. And that was what actually led me to join the union, so that we come together with our voices to demand for government to do what is needful by providing tools to work with. Because it's frustrating when you know what to do, but you are constrained because there were no equipment to do them, and then you need to refer. And also, Nigeria is, if not the #1 now in maternal mortality, then it was not the first, but at least it was ranked among the 10 then, because I'm talking about 25 years ago. So it was so difficult, seeing women suffer needlessly for what you know what to do, but because you are constrained by lack of decent work and understaffing, and also because of lack of equipment to work with, that you are helpless. So that is where my advocacy around issues of primary health care actually emanated from. And that led me to make inquiry about how can we expand these voices. I wasn't the only one, in this situation. And I started talking to my colleagues in that rural environment, and that led me to the union. And I started attending the union meeting, started seeing how coming together, combining our voices and putting pressure on government can actually yield some of the, the changes we saw at that level. So I think through my story, I've explained to you why the union is very important for health workers. It helps you to share ideas, to rub mind with your colleagues, and also to put your complaints together, to put pressure on the employer to solve your problems. And this goes a long way. We demanded for, employment of more hands because we were few. And we also demanded, that time, we demanded for, provision of water. And within the period I was there, we were able to get the government to sink a borehole in the hospital facility to make sure that water is available all the time. And we were able to, the pressure also worked in ensuring that government employ more health workers. The burden of care was, reduced on the few of us that was there, and makes life much bearable for all of us together. And also supply of at least the basic for, preventing, complications in the labor was provided at that time. So I have seen why the voices of workers coming together yielded very, very positive reports in their collective bargaining, in their advocacy and campaign. So I believe these are the important value that union adds to individuals who work in their respective setting in the public sector.
Thank you, Abi. I think you've captured it, very clearly through that story. I think Arlette will now ask a follow-up.
Ok, d'accord. Merci beaucoup à Abi. En tant que syndicaliste, j'ai une question à poser à Abi. Est-ce que pouvez-vous partager avec nous les différentes stratégies et les actions collaboratives que vous, en tant que membre, et les différents membres de l'international des services publics ont mis en place pour lutter contre la violence et ses dimensions de genre dans les programmes et les agendas internationaux? On sait qu'il y a beaucoup, vous êtes une syndicaliste, je dirais avérée. Voilà, on aimerait que vous partagiez avec nous ce qui a été fait. Voilà, merci. Puis la traduction, c'est bon, comme je parle rapidement.
Okay. It's a continuous work because there are still a lot of gaps. I think I should start from there. But I should say that we have done a lot as PSI, working through our affiliates in Africa. And I would say that addressing workplace violence is not a challenge that only the unions tackle. We at times also collaborate with other stakeholders to ensure, our campaigns produces the output that we want. But I would say we prioritize at PSI health and public service workers issues. And we also agree that health and public service workers face increasing violence, with women disproportionately affected. The gender harassment, assault, intimidation, and unsafe working condition undermine safety, staff retention, and service quality. And PSI affiliates identified that there is urgent need for workplace protection, leadership strengthening, and legal reforms. And what is our intervention in this area? We encourage and we support building union-led gender-responsive strategy that deliver protection and policy change. And what are the pragmatic actions we have taken in this regard? We have multi-country GBV projects that we currently run in Senegal, for instance, Uganda, South Africa, and on occasion, we have region-wide conferences that focus on, issues around gender-based violence. So what we do with our project is to build capacity of health workers through training, awareness campaign, and also developing prevention tools for the country level prevention tools that unions can use to mitigate gender-based violence. And we also build their capacity in the area of, convention, ILO Convention 190. And we build their capacities for them to be knowledgeable on this and to push within their nation with other allies, like-minded organizations, for policies for the C190 to be ratified and adopted by their countries. So far, we have about 10 countries in Africa that have ratified Convention 190. So we still have a long way to go when it comes to Convention 190 of the ILO in Nigeria, but we keep building their capacity to be knowledgeable about it, to also push their government and to ratify and adopt this into national laws. And this also have affected the way we, engage with government. While it was still difficult for the government to achieve for us to achieve the ratification with government, we push the government align their policies to Convention 190 so that at least we have a stopgap initiative that can still protect women in their respective workplaces, especially health workers. And also, we have participatory violence monitoring. Through consistent work that we have done with SOLISCO in DRC, we have a monthly awareness session. Unions, women gather together for monthly awareness session. And we also have a reporting pathway through the union and also an escalation committees. And this has given us the opportunity to, document real case resolutions, including legal actions and membership protection. So this is some of the things. Another one I would love to mention is that in Nigeria, we have a project protecting the internally displaced persons and frontline workers in conflict situation. And in our just recent AFRICON, that is the African and Arab Regional Conference for PSI, we have a lady from the northern Nigeria, giving her experience while she was on duty in a hospital. She was kidnapped by militias, and she stayed in their camp for 4 weeks or 6 weeks thereabout. And the union rallied round support to pay ransom for her release. So these are some of, apart from, focusing on the government, we also focus on the safety of the members, and the unions always rally support for such issues. Then, aside the project, we and the monitoring mechanism that we were able to put in place through our project in DRC, we also support women leadership strengthening. PSI is known for 50-50 women participation. Trade union is a very, very, male-dominated setting. And you will even see that in very, very gendered trade union, for instance, like the nurses union, the community health workers union, you will still see that the leadership have more men in position. So, but we encourage, we enforce true leadership training for women, more participation of women in leadership position. You cannot demand your right if you are not at the table. And we encourage the women. We say, if they do not reserve your chair at the table, bring one from your house. At least you are part of the decision making. And this is very profound, because now we have seen how involvement of women in leadership in union can easily transform union and promote the workers' rights in countries. So we have been able to support our unions to have gender and equality policy at the union level, and also to have women committees at all levels of the union structure. This is the way we use to strategically build capacity of women, encourage them into leadership. And when they are in position of leadership, it shows in the level of, the kind of collective bargaining agreements they have with employers. Issues like a provision of crèches in workplace, issues of maternity leave, issues around the protection of women from gender-based violence and harassment are included in collective bargaining, because they are at the table, they are part of the decision-making process. So these are some of the, and as per changing the system, not just in the workplace. Like I mentioned, we contributed also through our affiliates, and because of the capacity that the women now have, they also lend their voices to national discussions, national debates around gender-based violence and harassment in the workplace. DPSI developed a practical guide on implementation of ILO Convention 190, which is widely disseminated in the regions across the world. And this has been, like a guide to how the unions can build their capacity and also advocate for the ratification. And also through partnership and campaign, I said earlier that we collaborate with a lot of organizations, both at the national level, regional level, and also at the global level. Some of our partners is the Union to Union in Sweden, ILO, WHO, International Confederation of Nurses, and civil societies across the region, who are passionate about issues of gender justice and issues of women's rights. We also have a coordinated regional campaign promoting Convention 190 ratification and implementation. In our AFRICON, we have a 2-day focus on issues of gender-based violence and harassment in the world of work. And it featured prominently because we believe women's rights are unions' rights, and that the injury to one is injury to all. These are some of the, the areas where partnership with organizations also play out in our work. And as per policy outcome, we have some good news. In Nigeria, PSR affiliate play a very pivotal role in the ratification of ILO C-190, following, their pressure through the Nigerian Labour Congress. We have the chairperson of the current chairperson of Women Committee of Nigerian Labour Congress from the Nurses Union in Nigeria, and she also played a very important role in when the advocacy, was on. And also drafting new safety harassment reporting and survival support procedure is another, very important tool that we are engineering to help our affiliates document Because one thing that is very important for us to, to also talk about is the conspiracy of silence when it comes to issues of harassment, sexual harassment in the world of work. People keep quiet, but we want this to change. And it's changing because people are coming out to share their experiences and also to have it documented. We have, as an output of our African, we are going to embark on, collecting stories of victims in who have, in conflict zones, who have experienced issues around gender-based violence and harassment in the world of work. So what are the how have we been able to, contribute to shaping regional and international agenda? The PSI case studies is used in the ILO standard setting processes and WHO ILO guideline on the, protecting workers, the frontline workers in the conflict situation, and also on areas of gender-based violence. The African Union also were able to contribute our voices through experience sharing, and this helped in shaping the African Union GBV and occupational issues documents. Then, what are the measurable results? I've spoken about the Convention 190 ratification milestone in Nigeria. The GBV protection increasingly included in bargaining agendas and workplace policies, strengthening union monitoring system, and real case resolution. We have experiences of that in DRC. Increased women leadership, participation in leadership across the African region, and PSI being recognized as a key contributor to global worker protection standards. So these are some of the, the concrete measurable results we've been able to accomplish through all these intervention projects and efforts. Thank you.
Ok, nous disons... D'accord. Nous disons vraiment merci à Abi pour tous ces éléments de réponse qui nous édifient. Je vois que Abi est pétrie vraiment d'expérience en tant que spécialiste de la santé et puis syndicaliste. Elle a vécu beaucoup de situations. Elle a été témoin de cas où elle a vraiment intervenu. C'est vraiment une syndicaliste avérée. Et pour cela, j'ai un certain nombre de questions que j'aimerais poser à Abi. Des questions qu'on pourra peut-être essayer de scinder. Premièrement, j'aimerais savoir les mesures structurelles, opérationnelles, en termes de politique, qui pourraient être mises au profit par les travailleurs dans les secteurs de la santé et des soins de santé primaires pour lutter contre les violences fondées sur le genre au niveau du travail. Je ne sais pas si la question est claire. Philomène? Vous m'entendez? Ok. Mais je reprends. Ok, d'accord. Ma question est la suivante. Quelles mesures structurelles, opérationnelles ou en termes de politique pourraient être mieux mises à profit par les travailleurs dans les secteurs de la santé et des soins de santé primaires pour lutter contre les violences fondées sur le genre en milieu de travail? Et je continue. Et d'un point de vue plus holistique, lesquelles pourraient être mieux mises à profit afin d'améliorer la sécurité, le bien-être et la dignité au travail à ce même personnel-là. C'est beaucoup plus clair?
Well, I will attempt to answer the question. In terms of structural, operational, and policy measures, a lot still need to be done. And I'm happy we are having this conversation in these weeks of activism, because this also inform policy decisions in our countries. And it's important that we know that despite that unions, trade unions in the public sector, across the world have placing a lot of emphasis and also working around the issues of campaigning on gender-based violence and sexual harassment in the world of work. There are still a lot of structural, operational, and policy measures that we will need to put in place. And I will also be very passionate about this question because it addresses some of the, the concern that led me into unionism. We need to strengthen collective bargaining and workers' voice. The use of collective bargaining to secure enforceable protection, zero tolerance provision on harassment, survivor support protocol, safe transporting, and staffing requirements. This is important because binding agreements will shift the responsibility when all this, violence or abuse happen. It will shift the responsibility from individuals to institutions, to government, to employers, and ensure predictable remedies. Public health care workers, primary health care workers can push for inclusion of ILO Convention 190 principle directly into facility collective agreements and health sector negotiation framework. This will go a long way in tackling, mitigating, the issues of gender-based violence in the work and shift the responsibility from the victim, if it happens, to the government, or the employer of labor. 2, we need a gender-responsive risk assessment in primary health care facilities. Operational measure, we need to conduct joint union employer assessment of risk faced by women in night duties, in isolated posts, in community interaction, in facility layout, and in terms of pandemic or, critical situation. We need to see how this, impacts women more. For instance, during COVID-19, most of the healthcare workers could not go home. Even after being in isolation unit for months, they are going to pass through 14 days quarantine. And this also have toll on their psychological well-being. But who is taking care of those who take care of others? Who is talking about how this impacts them as individuals? So we need, to shift, the responsibility to governments, to employers, and also to institutions that can provide the necessary support to healthcare workers. 2, number 3, we need a union-led reporting and protection mechanism. We did this a little bit during COVID-19 in Nigeria through the Health Workers Union. We have what we call joint health sector unions network in Nigeria. And what did we do? We opened a platform, on a social media platform on WhatsApp. We call it the Situation Room. We understand that government always have their narrative about impact or, incidents when, issues happen, but we want the workers' narrative. We want workers who are daily experiencing pandemic situation in their workplace, who are facing human resource shortages because they are not enough in the facility, who are facing lack of PPE, they don't have protection gadgets to work with. We want their life situation reports, and this will help, in giving, evidence-based advocacy and negotiation when we come to collective bargaining. We are not going to just talk from government data. We are going to talk from data the union generates itself. And I think this is very important going forward. So, like I said, underreporting is a major barrier. Union-run mechanism reduce fear and stigma. And evidence gathered can be used to demand investigation, sanction, and improve facility security, as the case may be. Then another point is participation in social dialogue and policy reform. Primary healthcare workers, especially women, must have representation in health workforce councils, human rights, resource management committees, and occupational and safety boards. We have to have women. Like I said, if women are on board, they will be able to demand for women-specific issues. It can be as, as insignificant as even female toilet in some facilities. Toilet that will provide for, the reproductive, because most of these women are in their reproductive ages, toilet that can provide, sanitary towels, for instance, adequate water for use. These are very important. That is why we need to have women at decision-making from the grassroots to the highest. We need to have participation of women. So because advocate for mandatory women's seats and regular consultation at all levels, we, help to bring the issues of women to the fore and provide critical solutions, to this issue. Now, we need a holistic measure to enhance primary healthcare safety, worker safety, well-being, and dignity. At the facility level, we need to improve lighting, for instance, transportation, security personnel, panic button. In some places in the northern Nigeria, nurses and health workers don't wear uniform for night duties because they become easy targets when there is attack. So they go in mufti to, secure them. They look like every other person in the hospital. These are some of the measures at the facility level that needs to be provided. So this reduces exposure to harassment and assault, particularly for women working alone or at night. Then we need gender-sensitive human resource policies. Policies that adopt flexible scheduling, parental leave, protection, anti-discrimination rules, breastfeeding rules, facility-based accommodation for those who are working in hard-to-reach areas, and fair promotion pathways. This tackles structural inequities that heighten women's vulnerabilities. And we need trauma-informed psychosocial support system. This is, an awakening to some of us in Africa. We don't just, talk about health worker psychology. We need to put in place, psychosocial support, concrete psychosocial support that will provide access to counseling, peer support groups, and referral pathway for those affected by violence, and help, primary care workers recover from trauma, reduces burnout, and improve retention and attrition rates even in the workplace on the long run. We also need community engagement to shift social norms. Holistic measure collaborate with community leaders, women groups, and civil society to promote respect for health workers. We need to have these stakeholders engagement. And cite an example of what we did with our community health work in Nigeria. We had this community engagement. We visited some community in the South and also in the North. We spoke with the community leaders. Initially in the North, when you want to talk to communities, all the people that will come out are men because they are the leaders. But when we go, we request for the presence of some of the women because we serve them in our work as primary healthcare providers. We engage more with women in the communities than men. So we demanded to see the women, and we're able to, capture the real concerns of these women and also express the concern of the healthcare provider. At the end of the day, the communities see themselves as partners in progress with healthcare workers. What this does is also gives voice to, you know, the workers, when the workers start advocating for some issues around the facility, the community see it as their own issue also, and this amplifies the voices in our demand and our advocacies. So this is very important. We need to shift the note. The community, we need to make, you know, efforts to ensure there is collaboration between the community and also the health workers. National accountability and legal framework. Policy measures to enforce GBV and occupational safety laws. Mandate reporting protocols. Create sanctions for perpetrators, including safety indicators in health system assessment. One of the very important things that we need to do in terms of accountability and legal framework is to create laws that will sanction perpetrators of gender-based violence in the world of work. Because at times, this gender-based violence is not perpetrated by only community people, even within the health system. Because the health sector is well gendered, the women are at the lowest part, you know, of the structure in the healthcare system. The cleaners, the sweepers, the community health, junior community health workers, and in most cases, some of these people even have zero contracts, you know, which is also part of the how gendered it is. They don't have, you know, contracts that will give them job securities. So we need, you know, to look at this and also provide legal framework to back, you know, these women, and also to make sure that perpetrators are sanctioned and don't go scot-free. So primary health care workers can best be protected or best protect themselves from gendered workplace violence by leveraging on collective bargaining, structured reporting system, risk assessment, active participation in policy dialogue. But lasting safety and dignity require holistic reforms. We need government to reform the primary health care, you know, policy as a whole, to make it more gender, you know, gender friendly, to you know, have a policy that have the intonation that this is where we have majority of women, and we need to secure them, we need to protect them in the world of work. When we tell people that Convention 190 is not in the workplace, it's in the world of work, people often think, what is the difference? There is a huge difference, because the world of work starts from when you leave your door and you start to go to work, and ends at when you open your door, when you return from home and you open your door. So anything that transpires between you leaving your home to your workplace and back to your door is your world of work. And that is very important, that any kind of, you know, perpetration of gender violence, gender-based violence or harassment in this sphere is conditioned to be in the world of work. And it's important that women understand this, because this will help to push our advocacy and provide laws and policy reforms that will provide the necessary safety for women. I think I have tried. Thank you. I can go on and on.
No, Abi, I think you've touched on so much, and it has been so powerful. And your last point, you know, the world of work is a critical one, because violence can happen as you're traveling to work, as you've highlighted, in so many different forms, especially when your workplace, for example, community health workers, their place of work is even in people's homes. It's not necessarily in a health facility. So expanding that scope and being very clear about the rights, right to safety at all times in your world of work is a really powerful one. I'm conscious of time and I don't want to take up too much. We would like to offer the space for others to ask questions as well. But one quick one before I hand over again to Arlette is, if you had to give or pick one or two key pieces of evidence or information that is needed right now to really strengthen the response against you know, gendered workplace violence in primary healthcare, what would you say are the two key critical pieces of evidence we need now more than ever to push this agenda forward?
Wow. We need case studies for primary healthcare facilities. We need concrete human-centered evidence on systematic problem. We need, evidence-based data where people give actual, life accounts of, what transpired and what their experiences are. I think this is very important. And in terms of collection of this data and responding to, issues of evidence, we need a facility level reporting system, and integration into routine occupational health and safety. Every workplace needs a health and safety committee, no matter how big or small it is. We need health and safety, occupational health and safety committee that can, where it, the reporting can be channeled through. In most of the National Nurses Association, for instance, in East Africa, use survey data to demonstrate high prevalence of harassment during night shift, prompting staff and security reform. This is an example of how, this living situation can provide, the necessary data that we can use. Also, we need testimonies and workers' narrative. It can be, confidential or anonymous, but we need, workers' narrative themselves. We have to humanize the story. It's more passionate when we listen or we listen to people share their experiences. When we have, those life-in experiences, it points to the failure of the system in providing protection for the workers. Because it is not like it's a data that is generated on the system. It is a human being that is sharing those experiences. We need we also need data. We need data that we can support media and public awareness campaigns. We need data that will, provide the shift from public norms and build pressure for government action. Using anonymous testimonies, launch radio or TV discussion, coordinate social media campaign, etc. are very important, and we need a robust evidence, especially quantitative data, case studies, and legal precedent combined with strategic use of union platform, national policy spaces, and global forum. We provide a powerful basis for advancing protection and strengthening the safety and dignity of primary healthcare workers across the board. I think it is important that we factor advocacy platform and union strategy also into, this, we need to integrate gender-based violence protection into bargaining agendas and workplace policy in an evidence-based manner. And we use this evidence to negotiate, and put pressure on government to ratify, for instance, Convention 190 and align the Convention 190 or domesticate it. In some countries, it is an issue of domestication. In some countries, the issue of, adoption. Whatever the case may be, we need to have this in the legal system to give protection to women in the world of work. And as a professional association and health workers forum, we need to mobilize consensus among all health workers, especially community health workers, nurses, midwives, to co-sponsor panel discussion on safety, build coalition for policy reform, and expand membership among women. Example is we have the PSI Joint Nurses Association meeting. We have at the regional level we give technical support to the Nurses and Midwife Association in Africa. we support them technically in 𝗠tože, and these are some of the places, that we can also push for, for data, country level data that can support a region-wide, campaign and advocacy around issues of gender-based violence.
Thank you. In the interest of time, I will hand back over to Arlette. I think hopefully we can take maybe one or squeeze in two if everyone is okay to go over. And thank you, Abi, for sharing so much. I'm sure there are a lot more questions that are going to come, but we're soon hitting the hour. Arlette, would you like to go ahead?
Ok, merci beaucoup. Merci à Abi pour autant d'exemples concrets qui ont été faits, voilà, en faveur des femmes. Mais quand on regarde au niveau du chat, on voit qu'il y a un certain nombre de participants qui ont posé des questions. Peut-être on va permettre à ces personnes-là, on va lire quelques questions et puis voir. Nous avons une question de Bonnie. Voilà sa question. Bonnie de l'Afrique du Sud. Voilà ce qu'elle dit. Votre collaboration avec les acteurs sur le terrain et le gouvernement est très inspirante. Compte tenu des différents domaines prioritaires potentiels pour le gouvernement, des contraintes de temps et des défis potentiels en matière d'engagement, comment avez-vous encouragé, maintenu et soutenu l'intérêt et l'engagement du gouvernement et des autres parties prenantes pour ce travail et cette initiative? Et sa seconde question, c'est quel a été votre processus et quelles sont les principales leçons que vous avez tirées de votre collaboration et de vos interactions avec le gouvernement et les autres acteurs? Que peuvent faire les autres pour accélérer la collaboration avec le gouvernement et les acteurs sur le terrain? Telle est sa question. Merci.
Okay. The line was breaking here, so I want to read the question again from the chat. I think maybe it's better. The questions, are they on the chat room?
Voilà sa question. Oui, c'est ça. Voilà la question. Comment avez-vous...
Can the interpreter repeat the question again, because it's not very clear?
I think, Abi, it's now pasted in the chat. Do you see it?
Oh, okay. How you have worked, okay.
Maybe briefly, what have been lessons learned in terms of government engagement?
I've seen one of the questions. How did you encourage, maintain, and sustain governments and other stakeholders' interests and to the work and initiative? What interacting with the government and other actors? What can others do to fast track engagement with government and on the ground actors? I think we started by building, by creating awareness and building capacity for people to have knowledge about why we want to demand, for these laws around gender-based violence and harassment in the world of work. People need to understand what it is. And in understanding what it is, we have people who have practical experiences, and that creates the passion for the work. And in the union, we don't stop. We say the struggle continues until the victory is assured. So we don't really stop advocacy. it is what we breathe and what we eat, is what we do on daily basis. So the time you continue to create momentum, create awareness, get buy-in from stakeholders on the issue, then it comes to the attention of the necessary stakeholders in government, and you have your entry point to, put your issues on the table, influence policy. We work at an institution like the support, and also societies to also support in the cause. So while at the national country level, we continue to advocate, we put pressure also at the international level. Of course, our government, we go to UN Women conferences. They will also attend ILO conferences. And these are places we also, provide opportunity to meet with the policymakers and also, be able to talk to them, even outside the scope of the country level advocacy. And government don't want to be named and shamed. They want to always be in the good book. So this also help to facilitate the advocacy also. And when you talk about interests of stakeholders, there are people, organizations, locals, civil society and international, their work is based on social justice. So their interest cannot, shift from the scope. Once it is understood and we are on course, they will need when you need to advocate or to engage with government. I think bottom line is important for us to understand the issue we want to push. We have to understand it. We have to be back with evidence. We have to have it, through what is on ground, or individuals that are ready to also share their living experiences. And this will strengthen our advocacy and provide the fire we need for success. Yeah. I don't know. I think then another point there is what can others do to fast track engagement with government on the ground actors? I think I have met you. We have to, yeah.
I think
I've
Abi,
also mentioned that.
Yeah.
In the,
we were trying to summarize it to help with the translation. I think there was one other question. Monica, who is a teacher, had asked about, she's working in a school and they have a school nurse there. And she was asking, they're aware of new risks when it comes to nurses in schools, and any advice on safety policy in the settings of schools. And maybe the last question, just if we can combine very quickly. Francesco from the Swiss Tropical Institute is also working on violence in primary healthcare in Eastern DRC, and was quickly interested in monitoring mechanisms that you'd mentioned and building capacities of health workers in DRC. So maybe those last two, sorry. We are running very over.
For the school, every institution must have a sexual, gender-based violence and harassment policy. I think it's from there. Every institution needs a policy to safeguard both for instance, in the school setting, both the workers and the students. And, that provide, the first foothold, and also, I don't know, but I will just use my imagination and example from Nigeria that I'm conversant with. Every Ministry of Health have a gender desk. Every Ministry of Health have a gender desk. And these are some of the, a channel for reporting in case of violence, in case of abuse. These are channels for reporting. You can use the Ministry of Education, for instance, the gender desk in the Ministry of Education. In fact, some Ministry of Education have, a department or a unit that is working on issues around gender-based women or issues of gender and equality. And this could be, a very, very good, useful. And they have some documentation, they have in place policy. For instance, in Nigeria, we have that policy, even with the Ministry of Education, from, the kindergarten to tertiary institution. There are policies around GBV. We need to, find out for respective country, and we need to really, really, put it in use, because if we don't demand for our right at times, it becomes, dormant. We really need to request, demand for those rights to be in place. And particularly, there is need for occupational health and safety committee in school. And that kind of a nurse can be member of the occupational health and safety, and that will help. That will be, where the reporting, the channeling of the reporting and the resolution, and looking for resolution with the ministry can actually take place. There should be occupational health safety. For the DRC, yes, it is there. I will make reference to the union. SOLISCO is the union that PSI is an affiliate of PSI in DRC. If the person is working in DRC, can go in contact with SOLISCO union. They will be able to provide detailed information in terms of the monitoring and reporting and the capacity building that is ongoing in the union with the person.
Thank you, Abi.
Any other question?
I think those are the last ones. We are already 10 minutes over. I just wanted to hand over to Arlette to give the closing remarks on our behalf. Thank you.
Ok, merci beaucoup. Nous allons encore dire une fois de plus merci, un grand merci à notre, j'ai envie de dire, notre éminente présentatrice, voilà, qui nous a exposé beaucoup de situations, qui nous a édifiés. Voilà, beaucoup de commentaires ont montré qu'ils étaient vraiment intéressés par sa présentation, par tous ces éléments de réponse qu'elle a eu à apporter, tous ces éclaircissements. Nous disons également merci aussi à tous ces participants qui ont pris de leur temps pour participer à ce webinaire, qui est une première pour, pour le consortium. On espère qu'à l'avenir, on aura plus encore d'engouement tout autour du sujet, avec beaucoup de participation, et on aura plus de temps pour pouvoir répondre aux inquiétudes des uns et des autres. Une fois de plus, j'ai envie de dire des élévations pour notre docteur Abi, pour sa brillante présentation, tous ces éléments j'ai envie de qui chauffent le cœur. On voit qu'au Nigeria, beaucoup de choses sont faites par rapport aux autres pays où c'est encore dormant, il n'y a pas grand-chose qui sont faites à travers ces pays-là. Donc, merci beaucoup à Abi pour votre disponibilité. Merci à tous ces participants. Merci, merci et merci. Voilà. À toi, Joanna.
No, merci encore, Arlette aussi. Thank you to Arlette also for co-moderating. Yeah, just to echo everything she said, and also to thank Philomène, who's been a fantastic translator both ways, back and forth for over an hour. So huge thanks to everyone, and thank you. Goodbye.
Thank you. Bye.